Good day, everyone. So, today we will talk about gonorrhea, a common sexually transmitted infection that many people do not realize they have. Understanding what is gonorrhea, how it spreads, its signs and symptoms, and how it can be prevented is important for protecting your health and the health of your partner. This health teaching will help you recognize the infection early, know when to seek treatment, and learn simple ways to stay safe and prevent.
What is gonorrhea?
Gonorrhea is a sexually transmitted infection or STI caused by the bacteria Neisseria gonorrhoeae. It can infect the genitals, rectum, and throat of both men and women. This germ may infect the reproductive organs, but it can also affect the throat, rectum, eyes, and even the bloodstream. It is one of the most common STIs, especially among young adults. So, how it is spread? Gonorrhea is passed through unprotected sexual contact like vaginal, anal, or oral sex. Multiple sexual partner from an infected mother to her baby during childbirth. So important note, even without penetration or ejaculation, the bacteria can still spread with oral sex. And a pregnant woman with the gonorrhea can also pass it to her baby during childbirth, which may cause serious eye infections in the newborn. Signs and symptoms in men. Men usually shows symptoms more clearly, such as pain or burning when urinating, white, yellow, or green discharge from the penis, swollen or painful testicles. When it comes to women, many women, more than 50%, have no symptoms, which makes the infection dangerous because it can easily damage or silently damage the reproductive organs. Pain like painful urination, vaginal discharge, yellow or green, lower abdominal pain, bleeding between periods. If not treated, gonorrhea can cause pelvic inflammatory disease or PID in women. This is a serious infection of the uterus, fallopian tubes, and ovaries. It can lead to infertility or unable to get pregnant. Infertility in men due to testicular and prostate infection. And for both men and women, this can lead to higher risk of getting spreading HIV. Diagnosis. Gonorrhea can be diagnosed through urine test, swab test from the throat, rectum, cervix, or urethra. Gonorrhea is diagnosed by doing a urine test, where you can pee in a clean cup, or a swab test, where a nurse gently wipes the throat, rectum, cervix, or the urethra to collect sample. These samples are to check if the bacteria is present. Let's move forward to the treatment. First, gonorrhea is treatable with antibiotics, but it must be given by a healthcare provider. Second, both you and your partner must be treated to prevent reinfection. And the third, avoid sex until treatment is completed. So, gonorrhea can be treated and cured with an antibiotics, but these medicines must be given by a doctors or health workers. It is very important that both you and your sexual partner get treated so the infection does not pass back and forth. So, and you should also avoid having sex until you have finished the treatment. And the healthcare provider says it is safe. Prevention. First, use condoms correctly every time you have sex. Second, limit sexual partners. 3. Get regular STI checkup, especially if you are sexually active. Fourth, avoid sharing sex toys or clean them properly. Encourage early consultation when symptoms appear. If a pregnant woman has gonorrhea, it causes serious problems for both her and the baby. The mother may experience premature labor, infections in the uterus, or other complications. The baby can get infected during childbirth, which can cause eye infections, joint infections, or blood infections. That is why it is very important for pregnant women to get tested and treated for gonorrhea early to protect their health and their baby's health. In conclusion, gonorrhea is a common but preventable infection. By practicing safe sex, using condoms, limiting sexual partners, getting regular checkups, and seeking early treatment, you can protect yourself, your partner, and your baby if you are pregnant. Remember, early detection and proper treatment are the key to staying healthy and preventing serious complications. Stay aware, stay safe, and take care of yourself and health. Protect yourself, protect your partner, stop gonorrhea. Thank you so much. And I hope you learned something about my health teaching in gonorrhea.